Thank you for listening to today's episode of Medical Device Global Market Access by Pure Global. Today we're exploring the dynamic and growing market for dental devices in Mexico, a landscape governed by the Federal Commission for the Protection Against Sanitary Risks, more commonly known as COFEPRIS. Mexico represents a significant opportunity for dental device manufacturers, driven by a large population, an expanding middle class, and a thriving medical tourism sector, particularly for dental procedures. However, accessing this market requires a clear understanding of its specific regulatory framework. Under COFEPRIS, dental supplies are categorized as a distinct group of medical devices. These devices are then classified based on risk, from low-risk Class 1 devices like basic instruments to medium-risk Class 2 and high-risk Class 3 devices such as dental implants or bone grafts. To gain market entry, foreign manufacturers must appoint a Mexican registration holder or MRH. This local licensed entity is responsible for submitting the registration dossier to COFEPRIS and managing all regulatory communications and post-market obligations. All documentation must be submitted in Spanish, making professional translation crucial. There are three primary pathways for registration. The first is the standard pathway, which involves a full technical dossier submission. For a potentially faster review, manufacturers can use an authorized third-party reviewer, or TPR, to pre-review the dossier before it goes to COFEPRIS. The second major route is the equivalency pathway. This is an attractive option for manufacturers whose devices are already approved in highly regulated markets like the United States, Canada, or Japan. This route can significantly streamline the process by leveraging existing clearances. It's also vital to be aware of recent updates. On July 10, 2023, COFEPRIS officially implemented Edition 5.0 of the Supplement of Medical Devices of the Mexican Pharmacopoeia, which introduced updated classification rules and requirements, including for software as a medical device. Once a device is approved and holds a sanitary registration, compliance doesn't end. A robust technovigilance system is mandatory to monitor the device's performance on the market, and registrations must be renewed every 5 years, a process that requires a comprehensive technovigilance report. Navigating these requirements demands careful planning and local expertise. If you need help navigating the complexities of global market access in Mexico or over 30 other countries, we invite you to check out Pure Global. For more information and to access our free AI tools and database, please see the link in the description. Thank you for listening, and we'll see you next time.